Hi, I'm Angela Shetty. I'm your Unit Coordinator for HSC201 Health Promotion this semester. Assessment 2 overview, as I'm presenting now, is asking you to do an essay on a specific health promotion topic. And we're going to get you to address key principles, actions, models, and Indigenous perspectives. To make this a little bit different and a little bit more relevant to what you will be doing out there when you run health promotion, we're actually going to get you to start outlining your own health promotion project, okay? And we're giving you a set of criteria to follow to guide you on the way. So I want you to come into this assessment realizing that you need to pick out a target group, pick out a topic, and address the criteria as if you are putting together a health promotion of some sort for your particular target group. This relates to all the learning outcomes in the unit. It's valued at 35% of your overall mark, and the word count's around 1,500 words, meaning that we give you a 10% leniency either way. It's due Monday of week 8. So why is this assessment relevant? Well, in health promotion delivery, there's often a need to work with very specific target groups, okay? And you need to present a quality and relevant health education, health promotion experience for them specifically. An example is if we're educating young children in a primary school about being sun smart, or parents about ensuring their kids are safe on the internet. The type of health literacy of each of those groups is quite different. The way we go in and approach delivering that type of health education, health promotion would be very different, okay? So for health promotion delivery to be effective, we really need to understand what the needs are of different groups and understand that they are going to require different approaches so to make sure that our messages are understood and leading to change in their behaviour and attitudes for better health outcomes. So basically, one size doesn't fit all. Okay, so what we're presenting here is a number of different health topics that you can choose from to concentrate your health promotion on, and some examples of the target groups that we want you to choose from. So the idea would be that you might choose prisoners, for example, and you might do a health promotion based on mental health for prisoners or illicit drug use. What I've written down the bottom there is that we want you to be quite specific about your target group in your project. So if you're going to do prisoners, for example, we'd want you to outline what's the, are you looking at men, or are you looking at men and women, or just women? Are you going for a specific age group? Are you aiming juvenile offenders, for example, as opposed to mature-aged adults who might be in the prison system? Choose a location as well, okay? Tell us where they are, because the needs, for example, if you're choosing to address prisoners in Darwin prisons, we have an extremely high rate of Indigenous incarceration. So you would need to take that into account in comparison to, say, if you're choosing one of the prison systems around Melbourne area. So make sure you sort of get that straight in your head. So choose an area, one of the target groups and health topics that you want to find out a little bit more about, that you would find interesting to do a bit of research and to develop a health promotion strategy for. So I'm going to work through each of the criteria now. And the first one, as I've just said before, we want you to really tell us about who your specific target group is. And that helps us understand see if you understand what the differences might be in considering a health promotion for middle-aged men as opposed to teenage boys. So tell us who they are, tell us whereabouts they are. And I said it makes your health promotion innovative and focused. So criteria 2, we want you to provide an outline of why this public health promotion is beneficial for your target group, okay, and how you anticipate it's going to improve their health outcomes. What we want you to do is reflect back on what you've done in your first assessment, where we've had you researching some journal articles and finding some data and statistics and resources and so forth to back up a particular health disparity related to health determinants. So bring that forward now to your own health promotion. You've got your target group chosen, you've told us a little bit about them. So now you need to show us the background information of why this health promotion and this health education strategy is going to be something good for them. Why do they need it? Okay. Have they got high rates again of drug use in male prisons? Is drug use a reason why they might be coming into the prison system, for example? So have a look through. If you're choosing something like children, I'll use the example of SunSmart, you'd be having a look at cancer rates and so forth. So do that background information. This really helps validate what it is that you want to do. Shows us that it's relevant and that it's something that the population or your target group needs. Okay, so this criteria is a little bit challenging, but let's break it down for you. We want you to discuss the principles and considerations underlying your health promotion practice, contemporary health promotion practice in relation to your topic and target group. So we're asking you to sort of identify the values and attitudes in health promotion literature and the impact of these attitudes and power on the health promotion practice for your group. So we're asking you to look at the wider picture of why this health promotion is going to be needed, but also what's going to either impact its effectiveness, what might be some challenges that you might come across. It might be biased attitudes, it might be difficulty in reaching your group, it might be issues in health literacy levels of your group, it might be that this group receives very little health promotion that you're aware of. It's not publicised. So if we talked about prisoners before, for example, it can be quite challenging to be able to reach into and understand what the needs of prisoners would be in a prison system. It's not something that a lot of us are familiar with, so you'd need to do a bit of background research and not just sort of find out what the health data and statistics are about them, but what are the other issues you need to consider if you're going to be doing health promotion with them. And same with children and so forth. Like, it's not just about giving children messages. A lot of the time you need to consider what the parents might be have as an impact on that health promotion being successful and so forth. So what are the different ways and what are the different values and attitudes that we're seeing that we need to address as well out there to make sure that our health promotion is going to work for our group? Okay, so looking beyond just the statistics and the health data and looking at what are the other aspects that we need to consider if we're going to work with this group and do a successful health promotion, okay, and get our messages through that it might have that impact and make them rethink their behaviour, okay, and educate them a little bit more to make more healthy choices. So obviously with any health promotion we need you to set down a description of what you want to do. What are your goals and what are your aims? What are you trying to achieve? Now, be really specific about this. We generally refer you to use the SMART Economics, so I'll let you look that up and find out a little bit more about it. But really, when we look at your goals and your aims for your health promotion, we should be able to see very effectively who they're addressing, what it is they're addressing, and what they're hoping to achieve, okay? Your goals and aims are a very nice little synopsis of what it is that health promotion is going to be aiming to do. And quite often when you're putting these strategies and so forth forward in real life and that'll be one of the first things that reviewers will go for. They want to see what are the outcomes that you're expecting, okay? What is it you're going to try and do? And those aims should be a very clear way of getting that message through. So we generally say you should have around at least 3 or 4 aims. You don't want to have more than 5 or 6, okay? Because it just becomes a bit more of a list than a set of aims and goals. So keep them succinct, keep them focused on your target group and what it is you want to achieve. We've also then asked you, and this is quite a quick category to address, which one of the public health promotion management perspectives this falls into, and briefly outline why it falls into this category. So we have addressed these in Module 1, and I'll just give you a hint that it was, we're looking at primary, secondary or tertiary, and that when you're doing health promotion, there is a table there that shows you very clearly if you're going to address disease prevention with people who have no disease or no risk factors. They sit in a very specific group. Okay, so I want you to have a look at your target group, consider what you're doing, and tell us which one of those perspectives your health promotion sits in. And sometimes it can sit in more than one perspective because it might be involving a sort of group where you can have people who are both at risk or may have a disease or a repercussion from risk-taking behaviour. So go back into Module 1 and just review that, okay? And it's outlined very clearly there, so you know exactly what's required of you to meet that particular criteria. Okay, lastly, criteria 6, and this is the one I actually enjoy reading the most because students can come up with some really amazing ideas for different health promotions. We want you to provide a detailed outline of what it exactly is you're going to do. Okay, what's your health promotion activity going to entail? How are you going to do it? How are you going to promote this to your target group? So if you haven't already, go and have a little look and start being a bit more aware of the type of health education and promotions going on in the community around you all the time, getting put across the television to us, okay? We see them on our phones as advertisements. We see them on, you know, when we hop on buses. You see them in public toilets. When you close the toilet door, there's a health promotion education strategy or something there about prostate cancer, things like this, you know. So I've given you examples here. You know, you might think that something like the Breast Cancer's Mother's Day Classic Fun Run, for example, is you know, a bigger type health promotion activity that you might do. But when you're doing this particular criteria, make sure you sort of also present and show that you've considered what type of resources are going to work to get the message out. Such as newspapers, sports events, school visits, radio. What's going to work for your target audience? So again, if we're working with school kids, would you go to the school and run a session? If that's what you mean to do, then in this criteria you should provide a brief outline of what that session is going to deliver to those students. Okay, so we don't need a full session plan, but we do need some information to tell us what it is that health promotion activity is aiming to deliver. Okay, so you should have gone through modules 1 to 4 before you commence this assessment. And as we've said before in the previous assessment, there's quite a lot of resources available for you on the Bachelor of Health Science LibGuide, and we've got a link to that in the unit for you. Go onto online and Google a couple of health promotions that might have been done around your target group to get you some ideas started as well. And if you're really unsure, please contact me. I said before, this can be done via the course coordinator discussion board or send me an email. We've asked you in your presentation to use standard academic writing, which means structured paragraphs, okay? You can have a cover page if you like. You can use headings to define each of those criteria area if you like. Point form is okay, and tables are also okay to use in this assessment. Make sure you have a reference list at the end of your document using APA style. And you need to have those references, okay, to back up what you're doing. Again, validate what your idea is. Submit your response to the assignment criteria in the assessment to link that's provided in the LearnLine site, okay? And there is a draft submission point for you as well. So I'd really highly recommend that you actually use that draft submission and just check your work before you submit. So a quick outline of your rubric here, and I like to use these rubrics because it really helps indicate where your marks are going to be allocated across. Okay, so make sure you take the time to have a look at this, and it's attached to your assessment outline in your unit. So go for the excellent column, okay, and make sure you read down each side. So the first criteria is we want you to present an original community-focused public health promotion, prevention or management plan, okay, and that's got to be focused on your target group, all right, that you've got there. And when we're saying original, we don't want you just rehashing something that's already been done before, okay? We want you to come up with your own strategy there. We want you to show that you're able to identify and address all of the project criteria that I've just presented to you in relation to your target group's needs, okay? So you're not just going through and addressing the criteria, you're doing that keeping in mind who your target group is and what it is you're trying to work with them about. So as we're saying before, so we're reading through and we're seeing that you've really focused on male prisoners' health and well-being and doing a health promotion around some form of drug rehabilitation, okay? or illicit to address their illicit drug use. And the other criteria that I've got listed here is that you identify the proper or appropriate public health promotion management perspective. And that's what we were talking about before, whether it fits into that primary, secondary or tertiary level. As second years, when I did my first welcome to this unit, I did talk to you guys about the fact that you should have good academic writing and research skills now, and so we're giving a chunk of marks to you researching and utilising the literature effectively. And this goes back on that criteria where you're doing that background research to support the need for this particular health promotion. Okay, and so we've delegated marks on your rubric to show that you've actually done that research, okay, and that you've chosen good sources to support. So you're not just pulling up something because it mentions prisoners, that you've actually found a good journal article and got some good statistics from valid sources, okay, such as the Australian Institute of Health and Welfare or even the Australian Bureau of Statistics. The last set of marks on the rubric are allocated to your referencing and your writing style. Okay, so to finish up, I guess, is for you to reflect back on what we've covered in this assessment outline. We want you to choose your topic, okay, choose your target group and present a health promotion strategy or activity or some form of health education that addresses your topic and your target group. And you need to make sure you include all of those 6 criteria as you do that. Okay, make sure you reflect on the rubric so you can see where your marks are delegated and where you should be spending most of your time. If you are not sure how to get started, or if you've got a question on any of those criteria, make sure you ask, okay? Don't just sit there and waste time trying to figure it out, okay? I'd rather work with you and make sure that we get really good quality work submitted, okay? Because it all makes it easier to review for you guys. And generally we get some amazing work submitted, okay? There's you guys are the future of health promotion and all that out there. So let's start using those brains and thinking about what it is you could be doing out there now. So if you've got questions, as I said, put them on the discussion board so other students can see them as well. Otherwise, you can contact me by email or phone. Okay, so I hope you enjoy getting stuck into this assignment, and please contact me if you've got any questions.